The International Union for Conservation of Nature is urging South Africa as well as other drought-prone countries to invest in nature-based solutions to mitigate drought-related risks. This comes as drought-related risks are increasing worldwide due to climate change and demographic developments leading to poverty, food shortages and lack of access to clean and sufficient drinking water for vulnerable communities. Nature-based solutions was thrust into the spotlight during World Water Week, which is currently underway in Stockholm, Sweden. Meanwhile, aid organizations have been supplying water in some parts of South Africa, struggling to access clean drinking water. Gift of the Givers has been at the core of aid in drought-stricken areas like the Nelson Mandela Bay and areas hit by natural disasters like some parts of KwaZulu-Natal. Let's take this discussion further then. We're now joined via Zoom by Dr. Imtiaz Sooliman from Gift of the Givers. Always a pleasure to have you on the show. Very good afternoon to you.
Good afternoon, Flo. Thank you very much.
You're working on the ground and have been, providing water to areas that have been struggling with access to water. Let's talk about how real the situation of drought really is in the country and what your experience has been as a gift of the givers. I'm sure, being as close to the ground as you are, you have more insight for us.
It's a huge problem. This problem started more around 2015, 2016. If you look at those parts of the Northwest, then it went into the Southern Cape. The fires of Knysna of 2017 June, one of the reasons those fires were so big is because of the drought in the situation, and things burned very quickly, and also there was not enough water to put the fire off very quickly. At the same time, the drought affected economy in terms of from 2017 up to 2022 January, the sheep count, the merino sheep count, which is a prized sheep in the Sutherland area, dropped from 440,000 to 31,000. It decimated farmers, their income, the loss of jobs with farm workers. Now, this is all drought-related, which had a massive impact on the economy. And because of that, even in places like Makanda, university student numbers started dropping. And many shops and even franchises within the city itself were closed. And again, job losses were directly related to the drought itself. When there was no water, people didn't, and the tourists didn't come, guest houses were not busy, and then it was just a knock-on effect.
Speaking of the knock-on
concerns with COVID-19.
Yes, sorry to come in there, but speaking of the knock-on effects, and I'm glad you're talking about these direct links to other issues. Often when dealing with water shortages, we're also then dealing with other challenges that are coming on the back of that, and especially these are communities that really could do better. We could do better for them. Let's talk about the contributing factors. Some of the things that are also then affected. I mean, I understand that even service delivery then becomes a problem leading from that.
Yes, of course, lots of things will flow from that. And that's of course, on the one side, you have a lack of water because of a drought itself. Secondly, you have a man-made problem, where there's lack of maintenance in dams, infrastructure, pipes. The third problem is that even though the infrastructure and pipes is there, it doesn't go to all the areas. And then, of course, there's a huge population increase, which cannot cater and the water cannot cater for that increase in population. So in terms of, from the man-made problem, we are way behind on our maintenance, putting in extra dams, extending the dam walls. All that's an additional issue that affects the drought itself. So on the one side, I spoke to you about sheep. Secondly, I spoke to you about fire. Thirdly, that what was affected badly was the hospitals during COVID-19. And a lot of hospitals, we said, sanitize, wash your hands, be clean, disinfected, but they couldn't do that because there was no water. And the only way to deal with that, in the absence of rain, in the absence of dams being full, in the absence of desalination, the only other option was boreholes. And of course, we drilled many boreholes. Actually, in Sutherland, to save the sheep, we drilled 238 boreholes. In Makanda, in the crisis, we drilled 15. We put 11 in Grafdinet. In Klapplaat, also. And let's talk about another aspect. When there's no water in schools, the principals tell you, you know what, we can still do without drinking. But if the toilets don't function, we can't keep our children at school. There's 1,000 children here, there's 900 children here. What do? We can't keep them here when there's no ablution facilities. We need to send them home. You've lost so much of time already during COVID itself. And the same thing applies to universities. Now there's another effect. In the last few weeks, there's the Namatola district municipality, there's strikes. It's, there's no water. The water is flowing, but now because of the spec, the water can't come. The water is there, but it can't be delivered. And 10,000 students have been affected in Fort Hare University. Many getting dehydrated, many getting sick, many having all kinds of ailments because there's no water. So all these kind of knock-on effects come either from man-made crisis or from the drought itself.
Yeah. And I mean, I want us to talk about, you raise the issue of some are man-made issues, and I think that's the first place where we can address the issues. I mean, we certainly can't do much when nature decides to be cruel, but where we're having a situation where the problem is man-made. I mean, I was speaking to the MEC last week from KZN where they were, complaining about, there were protests about a lack of water, and he was blaming nature and not really reflecting on the issue of man-made problems. And maybe you can go into that for us about some of the problems that are actually man-made problems.
No. Yes, nature is part of it. It's not what it is. That's an easy way to escape.
Yes,
That's not correct.
Yeah.
Look for right now in Pinetown and Manning Hill and parts of Umzinto. We're drilling boreholes where there was no crisis, there was no water even before the floods came. There was no effort made to look at different communities and put in pipelines. It just wasn't there. And the pipelines that were there were so poorly maintained, or not maintained at all, that the whole system broke down. For example, in Tongaat, the entire plant is gone, or the entire area gone. So it's government has to take responsibility. Huge problem in every government facility. There was just no follow-up as mandatory. The finance minister, Ghana, where was the finance minister? Whenever new finance ministers come, they should have a specific budget for maintenance and infrastructure, a separate budget for that for the whole country, controlled by the treasury. That has to be done. This is just putting so much of pressure on people. With patients say people don't have water to drink, they can't bath their babies, they can't take medication. So that's a huge problem. It's not only infrastructure, it's not only drought related, it's infrastructure related. And then the other very, very big problem that we have in government is nobody takes responsibility. Is it national? National says they're not responsible. Provincial says they're not responsible. Municipal says they're not responsible. Who is responsible? Nobody takes responsibility for the crisis. For now, let's go back to the crisis in KZN and in Amatola district municipality. People on strike for 3 weeks. Do you sit back and just don't do anything about it? Or should all tiers of government get together and say, we need to find a solution rapidly? It's affecting the lives of hundreds of thousands of people in this area, in Eastern Cape and KZN. There's a total disconnect with all 3 tiers of government. And they need to sit together to find a solution to how to deal effectively and decisively with crises like this.
Yeah. All right. Thanks, as always, for your time, certainly your input, Dr. Sooliman. We appreciate your time here on SABC News.
Thank you.
All right. That is Dr. Imtiaz Sooliman from Gift of the Givers.